So now we're going to look for emergency warnings and signs of COVID-19. So if someone is showing any of these signs, seek emergency medical care immediately. So some of the biggest concerns we're going to see are, and these are the warnings, is if you see somebody really is having trouble breathing, that is seriously dangerous. Persistent pain or pressure on the chest, think of it that would very painful, it could be almost like a heart attack. That's usually a sign of bigger health problems anyway. You'd want to go immediately to the emergency room. New confusion, if they're kind of confused and disoriented, those are telltale signs. Inability to wake or stay awake, they're kind of dozing off and they can't focus. And blushing of the lips and face, so they're discolored, and we said if they can't smell or taste, that's definitely a sign of COVID. It's a pretty unique symptom of COVID. So now we're going to go look at a StoryCorps, and we're going to see about these women pharmacists that are living through the pandemic and what their experience is. So we talk about primary sources. These women are primary sources. They're living through the pandemic. You, if you're living through the pandemic, are a primary source, somebody a witness of the event, and we can interview you. So let's hear about their experience. Well, and it's a good documentation because they're living it right now and talking about it right now.
Vivian Leonard studied to become a pharmacist in Cuba before coming to the United States in 1961. Her daughter, Vivian Jr., eventually became a pharmacist too, as did Vivian Jr.'s daughter, Maritza. Today, the three generations live and work in New York City. They use StoryCorps Connect to talk about living through the COVID-19 pandemic. Vivian Jr. begins.
The hospital I work in is a 160-bed hospital. We went to 260 beds, and the patients were coding so often that we couldn't keep up with the medications. It was insane. One of the worst moments was realizing that the trailer was outside my office window. The hospital will report out each day. We have 30 in the trailer. We have 55 in the trailer. And seeing the bodies, at one point it went as high as the 80s. Mom, do you remember when Marisa came home that day from work and said, "You can't go to work, Abu. You can't go to work"?
Oh, yes. She wouldn't let me leave the house.
Well, I just knew it was so hard for you to not work because you don't know what life is, not working.
I know. I always work. My grandmother had good friends at own pharmacy, and when I was a little girl, she used to take me there. And I always liked science and chemistry, and I always said I was going to be a pharmacist. That was my calling.
I had to basically tell you, okay, you want to go to work? You can go. Just tell me who are the 10 people you want at your funeral. And I'm sorry I had to be that blunt with you.
I follow their instructions, but I miss the people, and I miss my work.
I feel like I am who I am because of you. I wanted to grow up to be like you.
As a result of this pandemic, I think that we express more to each other how much we love each other and how much we need each other.
I am just hoping for a fourth generation pharmacist.
Right.
So I'm sure many of you guys can maybe connect with and identify the fact that this pandemic has really showed the importance of family. And that has been one positive, maybe, consequence of the pandemic. It's really hard to find a positive sometimes. So now we're going to look at the effects of COVID-19, some risk factors for death. A couple of things you want to think about is how disease can kill. So 80%, here's some facts on it. 80% of people are asymptomatic or suffer very little symptoms. Most people suffer very little symptoms, and probably about 5 to 25% of those people are asymptomatic. So there are people walking around COVID-19 that do not show at all. We've seen kind of a higher rate in this maybe in children and teenagers. You might be more likely to carry it without showing. 20% of people that are infected are hospitalized with serious health issues. So they actually go to the emergency room or they go to the urgent care and they have to be actually admitted to the hospital. Of that 20%, about 18 to 19% of those people are infected by COVID-19 suffer lung, heart, and even long-term brain damage. That gives you something to think about. It's like, wow. A lot of times we talk about this last factor, the 1% that actually die. So 1% of people infected COVID-19 die. Right now, we believe it's about 190,000 people. That estimate by most physicians and virologists is low. The reason it's low is because if you die and you haven't been tested for COVID 19, they don't factor your numbers into the death rate. So a lot of people are dying from COVID 19, we believe, and we're not actually counting them into the death rate. So it could actually be a lot more than 190,000 people. And it keeps growing. Some estimates say that by Christmas next year, we could see almost 400,000 people have perished. Now, that's a very scary fact that almost 500,000 people could lose, and probably a lot more than 400,000 we don't know about. People think they're dying just of a heart attack or other issues that aren't being counted. But this 18 and 19% is pretty concerning too. So, yes, 1 out of 20% of the people are actually dying from it, but 18 and 19% of these people are living with, they're going to suffer lung damage, heart damage, and even long term brain damage. So, people that go into the hospital, they come back and they have a lot of issues. They have circulation issues. It's a respiratory infection. So they have a lot of lung issues. And the heart can get damaged from this. And the way that this gets damaged, and even the brain, because oxygen's not going to the brains, is if you look to the right, first of all, you should be asking again, Mr. Metropolis, where'd you get your information? And I put that at the bottom of the page. I am a contact trace trained teacher. I was trained to actually do our school if we have any outbreaks. That I'm the guy that would kind of call people privately and confidentially and just say if they've had contact with someone. So I was trained through Johns Hopkins Hospital, which is considered one of the most prestigious and best hospitals in the world. I'm going to put them as a very valid source. And on the right, it says risk factors, and this is from the CDC. So again, that's the Center for Disease Control for the United States. That should be a pretty valid source as well. How the disease could kill. If the lungs cannot recover, the patients can't breathe on their own. So there's when you lose oxygen to the brain, it causes damage to the brain, problems with the lungs and the heart. And when they do recover, if they do recover, then they have damage, long-term damage, things they're going to have to deal with the rest of their lives. Lack of oxygen can damage the organs in the body, causing increased risk of heart attack, kidney failure, strokes, and even clotting disorders. So people might die from things like heart attacks and strokes. It really might be actually caused by COVID-19. We won't know because if they haven't been tested for COVID-19 and then they die, they don't really go back and test you for COVID-19. That's seen as kind of a waste of testing and money. So they're not factored into our actual conclusive rate. So we actually don't know exactly how many people have died from this. We assume about 190 at this point. Okay. Now, before we get into this woman's story, I did want to go back and show you one more of these stories, and this is interesting. This is for the first time nearly a century, a family reunion. So we know in African American culture and most cultures, there's a real strong tie where the family wants to meet. And we're going to look at a story core on this family and how they wanted to meet and how COVID-19 has affected their experiences. And I think maybe some of you guys have experienced certain issues too, where your family is going to have a reunion or so forth or so on.
This is a story about how the COVID-19 pandemic is impacting a powerful tradition in African American life: family reunions. Every year for nearly a century, the Quander family has been coming together to honor and preserve their history, one which includes the story of Nancy Carter Quander, who was one of the 124 enslaved people freed by George and Martha Washington. The Quander family reunion has taken place during the second weekend of August since 1926. But for their 95th celebration, they were faced with a difficult decision. Speaking remotely through StoryCorps Connect, Rahulamin Quander and his cousin, Alicia Argret, talked about reunions past and how this one was different from the rest.
The first Quander family reunion was held on August the 15th, 1926. They kept a record book. And the record book talked about succotash. It talked about potatoes, cakes and pies, plenty of iced tea. It's always a very loving, very happy occasion. There are a lot of hugs, a lot of talk about new babies, who has gotten married, and sadly, who has passed away. This one would have been the 95th reunion, but because of COVID-19, the family decided to not have a face-to-face this year.
I went to like a family reunion when I was really little, but I think it was a little bit later that I realized how precious it is to be a part of a family like this.
The Quander family is a very old and extended family. When George Washington died, he provided in his will for the freedom of his enslaved people. And one of those people was Nancy Carter, and she married Charles Quander. So this is how it gets started. Your great grandmother, Gladys Quander Tansel, was one of those griots who was a keeper of the story. Her interest was sparked as a child because she went to her first reunion in 1930. Your great grandmother and my father went to college together. And she always had such interesting things to talk about.
So, if you could pass one thing on to me, what would it be?
Well, the one thing that I would pass on to you is that you are the keeper of the stories.
Oh, okay.
I have to tell you, the lack of sustained interest has bothered me. I'll be 77 in December. I don't know what's going to happen.
I'm definitely going to put an emphasis on this for like my kids. And as we've seen this year, you never know when your last one could be. And I think it's important to capture those opportunities while you still have them in your grasp. And I'm going to do what I can on my end to keep the spirit of the family alive.
So I hope you guys are enjoying the story corps. You're actually going to be doing a story corps for us this year in your family. That's an interesting story about former slaves of George Washington, who was actually interesting in his approach to slavery. He was so intent on keeping his slaves, actually, when he was president of the United States, that when he lived in Pennsylvania, because the original capital of the United States was Philadelphia, he would have to go back, take his slaves back to a slave state like Virginia every 30 days or so, because there was a law that Pennsylvania was a free state, and if a slave stayed in Pennsylvania for more than 3 days, then they were freed. And George Washington actually continued that. But at the end of his death, his wife and him did free the slaves, his slaves that he owned at the time, under Washington's huge, vast wealth and land ownership. Okay, so now we're going to look at another story. This is a story, a woman's story from a hospital bed brings Anderson Cooper to tears. This is really good. It kind of, I hate to do this, but it shows the consequences of COVID-19 for those people that do live and do make it through this. How the disease can kill, lungs can't recover. We talked about that. Important risks for deaths. Risks for deaths depend on the access to care. So people in poor areas like rural areas or maybe inner city areas or places that they don't have access to health care, they're in a lot more danger. So we know, for example, in St. Louis, we're pretty lucky. We have Barnes, SLU, just to name a couple of the hospitals we have. And we have a lot of access to healthcare in St. Louis. We're one of the most healthcare friendly cities. That is not always the case. Some places you can go for very long periods of time without any access to a hospital, especially in small parts of rural Missouri. Death is rare among young and healthy people. However, it does happen. Death is more common amongst older people. We agree to that. 65 to 75-year-olds are 2 to 5% more die. 75 to 85, 4 to 10% of those people die. And 85 and older, about 10% die. And on average, it's about 1% total. Okay, so we're going to watch this story real quick.
If you shop on Amazon, you should use Wikibuy. It's a browser extension that automatically...
And a note before we bring you this report by 360's Randy K. Some images may be disturbing, but it's important for you to see.
Rosa, nice to see you.
Nice to see you too.
This is the only way we could see Rosa Felipe. The 41-year-old mother of 2 young boys has been hospitalized at Jackson Memorial Hospital in Miami since early March after testing positive for COVID-19. She's fighting to survive inside the very same hospital where she worked for more than 15 years as an electroencephalograph, or EEG technician, testing brain activity in patients.
I do all of the EEGs wherever they're needed, whether it's in the emergency room or trauma or in a separate floor.
So you would travel around the hospital quite a bit and possibly got exposed?
Quite a bit. Quite a bit.
You were seeing a lot of patients?
A lot of patients, yes.
Rosa has 2 underlying conditions that put her at even greater risk: asthma and diabetes. It got so bad, doctors put her on a ventilator to help her breathe.
I actually asked
the doctor for a piece of paper before being intubated, and I wrote on the paper to my children, I wanted them not to give up and not to be upset with God, because this was, if something were to happen to me, this was His will, and I didn't want him to be upset with God. I wanted them to be loving and happy that God allowed us to have the time that we did have. And then after that, I just gave it all up to God.
Rosa spent 2 months on the ventilator. It saved her life.
I am still grateful that I'm alive. I'm grateful that I made it.
But now Rosa has another problem. While on the ventilator, she may have developed blood clots. Her hands were likely starved of circulation and oxygenation, so her fingers turned black.
My fingers are gonna fall off. Let me see if I can show you my hands.
Yeah. And that's because they weren't getting any blood.
Exactly. The left hand, which is in better shape.
Rosa's hands may have to be amputated. At the very least, she says, she will lose many of her fingers. Rosa's family wasn't sure she'd even survive. Her sister told me she was already planning her funeral. What keeps Rosa going is the thought of seeing her children again, who she hasn't seen since she was hospitalized in March. When do you think you'll be able to see your children again?
For me, it can't be soon enough. For me, it can't be soon enough. But I know that in the end, I'm going to be with them. I know that. So that's what keeps me focused, and it keeps me wanting to heal and wanting to get out of here fully restored.
Alone in her hospital room for more than 5 months now, Rosa admits she's had some dark thoughts. So more than ever, she treasures life's sweet joys.
On my behalf, could you please congratulate Anderson Cooper on his baby?
I certainly will. These are the things you think about when you're laying in the hospital bed.
Yeah, I'm happy that he has a baby and that he's so cute.
Well, I will share your blessings with Anderson and Wyatt.
Thank you so much.
All right.
Have a great day.
Be well.
Randy Joyce.
So sweet, right?
I mean, wow, what she has been through.
Yeah, and what she's still going through, Anderson. And yet that was the only time in our whole interview that she smiled, was talking about you and Wyatt. I mean, she's been in this dark place. She was on that ventilator for a couple of months. She's going through possibly losing her hands. She hasn't seen her children in a couple of months. She was in this dreamlike state where she was watching her life go by on the ventilator, she remembers. So it's been a really scary time for her, and she hasn't had any visitors. So when we started talking about you, that's when she really lit up, and I think she's really clung to that as sort of this bright spot in all of this. You know, we see what the pandemic has done to her and her family and so many others, and it was just really sweet, Anderson, that moment, and all she wanted to do was talk about you and baby Wyatt.
I want to talk to her. Thank you, Randy. Appreciate it, and we wish her the best, and we hope she gets to be reunited with her kids really soon.
So you could see one of the consequences of COVID-19 is also when you go to the hospital, unfortunately, you are unable to see your family. That is starting to change a little bit, but people are unfortunately stuck and dying in the hospital alone. So highest risk groups, this is some important information for us to understand. Cancer and certain blood disorders increase weakened immune system. Anybody has any kind of weakened immune system? Chronic kidney or liver disease. Type 2 diabetics, which are, they get it later on onset of life as opposed to born with it. Severely obese people tend to have higher rates. Serious heart disease people. High blood pressure and type 1 diabetes increases your symptoms of COVID-19 and likelihood. Type 1 is you're born with it. So we have, there's a lot of myths about diabetes. You have people that are in fantastic shape that have diabetes, but it does increase your risk. Also, we're not sure what's going to happen with the flu season hitting at 100% with COVID. They're both lung issues. Now, this information is provided by the Mayo Clinic, which again is one of the most prestigious hospital in the world. Honestly, it's up in Minnesota, Rochester, Minnesota. If anyone is infected, this kind of gives you a diagram to the right. You can see one person gets infected. The average person infects about 2 to 3 other people. So that means those 2 to 3 people will infect another 2 to 3 people on average. And those 2 to 3 people will infect another 2 to 3 people. And you can see how this quickly gets out of control. And that's what my job as a contact tracer. And if you choose to, when you get older, to go into that, is to actually try to find those people and tell them to quarantine so they don't spread it anymore. The problem is you don't see effects for the first 2 days usually. This is another video of a coma. This is a guy that we think of. This doesn't happen to healthy people?
Just, it's an
this guy disagrees.
flu, and you're thinking it's an overhyped flu, and I'm not gonna get it. They put me in a coma, and they put me on a ventilator, and I wake up the next day. I'm in Baltimore at Hopkins.
He's a very athletic, fit individual, and he's young. And so my first thought was, wow, if this can happen to him and he can be this sick, this can happen to anybody.
I was basically paralyzed. I couldn't move. All my muscles were gone. I try to walk without the walker. Okay, let me hold your hand. Okay, then I kept pushing them like, I want to do more. Are you tired? No, I'm not tired. Even though I was out of breath, my heart rate was up. Let's do it again. I was just determined.
So that's something to think about. The honest answer on how people respond to COVID is we have no idea until you actually contract it. And that is my presentation. What I want you guys to think about is please follow the minimum requirements of wearing masks, 6 feet in distance. And we're going to talk about in class on if this is a problem that can't be solved or is this something that could be contained and what structures and how would history, government, and all these things contribute. Thanks for staying with Mr. Metropolis. Have a good day.